Welcome to the Extraordinary Health Podcast. I'm here with your host, Dr. Paul Beckham. My name is Allie. We also have Liz here.
I'm back.
Today we're going to be talking about adding years to your life and life to those years.
Who doesn't want that?
I want that. Everyone's been looking for the fountain of youth since Ponce de Leon, right?
He never found it either.
That's because he was looking in Florida. Yikes. But if you're looking to add years to your life and life to those years,
That's alligators.
Look no further.
Alligator skin, hey, if that's what you're looking for.
So, adding years
I'll
to
get
your
into
life.
here. So,
Yeah, there you go. Let's go.
How can we add years to your life? Well, in general, we want to start to look at like a lot of natural health care is more geared towards doing things proactively with your health here as compared to, traditional medicine where it's a reactive thing. You go in because you have something going on and you need to get it addressed and you need to get it addressed now. And then you're really not focused on even how to stay healthy even once you take whatever medication or have whatever surgery done with chiropractic, naturopathy, even massage therapy, and lots of more natural healthcare perspectives. It's looking at your health proactively. So what can we be doing here to help you out, stay healthy as long as possible so that we can add some years to your life and life to those years. And in our office, your initial exam, we're going to be looking at a lot of different things here to even address what kinds of therapies in the office that we could help you with that would help do that. And once we kind of go through that, today we're just going to try and cover, all the different therapies that can kind of happen in the office here. So you get a pretty good idea of how we can help you here. So right away, if you come in as a chiropractic patient, you're going to go through initial exam and assessment here. I'll take you through even some screening tests myself so we know exactly what we need to even maybe dig a little bit deeper with. But if you qualify, let's say you qualify for everything here, I'm just going to start off then with what kind of treatments you're going to have. So obviously we go through the traditional chiropractic treatments where we're going to be looking at your brain and your spinal cord as well as the vertebra that surround all that and your skull to make sure that we have the proper alignment there. So we're removing any kind of stress on the nervous system. That's a part of your treatment here. But another way that I look at it here with my extremity training is through what's called your kinetic chain, which is then starts at your feet and works up from your feet and goes up through the spinal column and goes out through your arms from your shoulder blades and collarbones all the way down to the tips of your fingers. Also included there would also be the ribs and your TMJ or your jaw. So all that's going to get assessed, and we're going to make sure that we're dealing with exactly what's kind of causing the problem. We want to get down to that root cause there and make sure that all of that is dealt with. From there, we're also going to look at other soft tissue type things. I might do some manual soft tissue work. We have some instruments that can kind of help work out things like myofascial trigger points or fascial adhesions, things that might be restricting how your bones and joints are moving. We'll also use something called the vibrocussor. That can kind of help loosen those muscles up. There's adjusting instruments that can help adjust the spine or the extremities. Usually when I'm then done getting all that stuff kind of treated, I'm going to hand you off to Allie here, and she can kind of explain some of the other therapies that we have.
So one of our more common therapies that we provide in the office is going to be high voltage ultrasound. Now we're not talking about the diagnostic ultrasound that you may have had at a hospital in the past. So the high voltage ultrasound, where the high volt comes in, is going to be our electric stimulation. So we'll put stim pads on your muscles that kind of vibrate, and they can be used for many things, activating or soothing the muscles. And in conjunction with those stim pads, we will also be using an ultrasound wand, which is going to also warm up the tissues, help us find those trigger points, and kind of release that tissue in order to make you feel better quicker, basically.
Yeah. And I've used that on patients for 30 years, and it is just something that, can help. It's definitely therapeutic, but it's also diagnostic with some of those trigger points, so it can help you find those and get them knocked out. So
Yeah, that's pretty relaxing, I feel. Most people like high volt ultrasound.
It's the warming too. Yeah, people really gravitate towards that. And we get good results. Yeah.
Another therapy that we have here is PEMF, which is pulsed electromagnetic field. And
Therapy.
So we have the chair with pads, or we also have a zero gravity bed that will kind of distribute the pulses throughout the entire body. We also have a couple different tools that we can plug into the PEMF as well, such as pads or rings that can be used on different extremities or different joints that are not connected to your spine. And that pretty much what it does is it electrifies your cells in your body and gets everything moving. And you can we have different kind of settings that we can put depending on what the patient needs. So if they need more of like a relaxing treatment, we'll use a different frequency. Yeah, a different frequency compared to someone who needs to kind of detox their body of something. So trying to get something out of the body. So it's kind of a cool therapy. Yeah.
More stimulating, yeah. And it's something where, your body's like a battery is probably the easiest way to describe it to people so you can understand it. It's that a lot of people, you feel like you're just losing energy in your body, and it's just going down, down, down. And what PEMF therapy does is helps to kind of recharge your body's batteries, which are the mitochondria in your cells. So typically, if somebody's going to use that, we're going to want to make sure that they're getting enough minerals, which you can get through your diet, which I would highly recommend people eating things like dark green leafy vegetables. If they're not going to want to eat something like that, a magnesium supplement, or if they want to go to an organic source to get it through a supplement where you get a bunch of minerals, it's a fulvic or humeric acid. It's basically a drink that you can take that is natural minerals. There's actually no taste to it. It looks like it's black, but you don't taste it. It doesn't stain your teeth or anything like that, but it definitely can help out with just getting the proper current in your body there. So,
all right. So, I guess our third therapy that I'm going to talk about here is going to be our class 4 laser therapy. Class 4 is a little bit different from like a class 3 laser, which you may or may not have experienced in the past. It's called a cold laser. Those are a lot more common.
The class 4 is still technically a cold laser, although it can, get warm. I mean, just because the diodes do get warm on it.
I was getting to that. In fact, that is one thing that we will ask you immediately to watch for as we're performing the therapy is let us know if it feels like it's getting too warm, because that can be uncomfortable. We don't want to hurt any tissues. We're here to help. But yeah, so the class 4 laser can be used for, basically anything except directly into the eyeballs. But it can be used for, local things like abrasions or bruising, sprains, strains, things like that. Or it can be also used for systemic issues such as I believe there's even a setting for ADHD, anxiety, depression, things like that, or even autoimmune issues as well, like our neuropathy treatment is more of a systemic thing where we start, if it's lower extremities, we're going to start at your low back, kind of right where all of those nerve endings are coming out near your sacrum there, and we're going to work our way down those lower extremities one at a time. Mm-hmm. And with our new laser, that treatment takes about 3.5 minutes per extremity, so pretty quick in and out. Even if you have to do upper and lower extremities, it's only going to take us, what's the math on that?
It's like a 15 minutes of doing
15 minutes
both
total,
arms and legs there. Yeah.
Yep. So the laser is actually pretty darn cool, pretty high tech, but so
and actually that new laser too, it's nice because there's a lot of safety features built into it as well.
Oh
So
yeah, as far as skin tone and things like that, there's even settings for, acute or subacute or chronic conditions. So we can really dial it in and make it more of a custom treatment per the patient and what their needs are.
So another therapy we have here is decompression, or traction. Believe they're interchangeable. We have the lumbar traction, and then we also have cervical traction, depending on what the patient needs. Pretty much what decompression does is we put you're kind of strapped in with a little seatbelt and everything to a table, which we raise or lower to have it at a certain angle, and then you're also connected to the machine, which will be pulling while you are stable at the top. So pretty much what it's doing is kind of pulling your spine apart in whichever area that we're trying to focus, and trying to get blood flowing back into the spine there, and just getting that curve corrected.
well, and it's the big main purpose of the decompression is to help rehydrate the discs. I mean, because the only way that the discs can get rehydrated and get the proper nutrients in them is by what's called imbibition. So it's basically kind of sucking in the fluid from the bones, the vertebra above and below those discs. So what we're really seeing here is that we can get some disc height back into the spine there, in the areas where the discs are thin, and that's where we're trying to, yes, dial it in with specific angles. Also, depending on the patient, the specific amount of pounds that we're pulling, but that's all programmed into the head, which is all run by a computer, and the patient goes through the therapy. And a lot of times we combine that with some of the other therapies in the office to get even better results too. So
Yeah, sometimes it's hard to wrap your head around how little blood flow there is into those intervertebral discs, and so getting those pulled apart is allowing all of that stuff to get moving in there, which is really nice, and it can help you feel better faster as well.
a lot of people, you'll see them. I mean, within a few treatments of it, they're like, "Oh yeah." I mean, I would say 2-3 treatments. Most people are starting to notice it. It might take maybe up to 2 weeks for some people, depending on the severity of the condition. But within that first couple of weeks, just like an exercise program, I always tell people that first treatment, you might feel a little achy and sore because all of a sudden, we're getting some joints moving that have degenerated probably, over a period of time. That's why we're using the therapy in the first place. And with an exercise program, you start it up, you're going to get a little achy and sore, and that's, if anybody feels anything, it's usually that. And then as they go through it, just like exercising, it gets better and better and better as they go through the treatment. So
All right, so I don't know how I got stuck with this one. I guess, I don't know, by design, but my favorite therapy is coming up next, and it's shockwave. Our focus shockwave therapy. Pretty neat stuff. So can also be used for a variety of things. We've most recently kind of added it to our neuropathy protocol in the more severe cases. It's great for, acute and subacute soft tissue injuries, treating things like frozen shoulder or dislocated shoulder. I use it. Yeah, I use it for my plantar fasciitis. I use it directly on my plantar fascia on the bottom of my feet. I also use it on my calf muscles and on my anterior lower leg muscles, and it really helps free things up. Basically, what it's doing is it's increasing blood flow, increasing that cellular metabolism, decreasing that inflammation, and it actually stimulates the production of stem cells, which you may or may not know helps things heal pretty quickly. Those stem cells are very valuable, and anything that's going to increase that stem cell production's, again, going to get you better, faster, and where you want to go.
Mm-hmm. And a combination that I like to use together with patients here is the focus shockwave with the laser, because between the two, they cover the whole gamut for stimulating your body's own stem cells, to help your body heal itself. So that's where we see the best results with people here. Even combining that, people do have some degenerative discs. running it, right over that area where they have the degenerative disc going on, using that focus shockwave, getting them decompressed, and then literally using the laser. So a lot of people, since we've been using these kind of in combination, the chances of them feeling kind of achy and sore is pretty minimal.
Yeah, and the shockwave too is something that's going to keep working on your body long after the treatment has ended. I tell people, you might feel better for days, weeks, and continue to feel better as long as you're not re-injuring anything.
Well, and what the research shows is that even after you've gone through a course of treatment with the shockwave, it actually lasts for another 12 weeks after we're done with that course of treatment. So, say you get treated over a 3 month period of time, it's still helping to keep those stem cells stimulated for another 12 weeks after we're done. So,
yeah, a lot of the research that I've come across with shockwave therapy, they check in with their patient groups, their case study groups, for about 12 weeks, 3 months after, but they also check in with them 6 months after and 12 months after. And granted, those results aren't gonna, they're pretty minimal for growth after that, but it's still there. It's still lingering. So,
and depending on the severity that a person has of something going on, a lot of those mild to moderate cases, a lot of times once we're done with that initial treatment, they're probably done. We probably don't need to follow up much with that. With the severe or even extreme cases, they're probably going to need some follow up after that. I think what's kind of interesting is that, like the Major League Baseball teams that have shockwave, they literally use it on all of their players. I think it's twice a month on them, just to kind of go through their arms to make sure that all of the muscles and tissues have been worked on, because it's diagnostic, because it'll help find the spots where they're really bad, similar to our high volt ultrasound here. But that focus shockwave actually penetrates like it's 5.7 inches, almost 6 inches deep. So you can really affect a lot of tissue there and get a lot of healing going on, especially in areas, again, where there's pain and inflammation. So anytime, like baseball players, where you're constantly throwing a ball, you really are stressing a lot of those muscles in that, forearm and upper arm. Hey, to run through and have that whole arm treated, I think the modern day baseball players are getting some really good treatment here, especially for the facilities that do have it, to make sure that long term they're preventing injuries here. So,
Mm-hmm.
I think every professional team should have one.
and I'm sure it's becoming more and more prevalent. I don't know of other places offhand. I'm sure almost all of them, once they get to see what it really does and how it helps and how fast people can get better, yeah, you're going to see it all over the place. We've had ours now for a little over a year, and yeah, it's just crazy to see the results that we're getting with patients here. And yeah, the tougher ones are the people that have had more severe to extreme type conditions, but a lot of times that helps at least make it tolerable for them to get around, especially if they have some kind of degenerative knee, osteoarthritis going on, or a hip osteoarthritis. But, once they kind of get out into those areas there, they're probably looking at a joint replacement, but that's something hopefully we can help stave off, or at least make tolerable for them for a long time. So what else we got here?
We also have exercise and rehab here.
Yep.
So, depending on the patient as well, when we're doing our initial exams, like when you're doing those with Allie and I, we have different movement screenings, exams that we can do with patients, and pretty much we'll just get you at a starting point. It'll just have a couple different movements just to see how the angle of how far you can move which way. And then when we have our exercise and rehab programs that are pretty much just going to be, basically we'll start with like structural rehabilitation. So kind of using the wobble chair or doing the SRT program and stuff like that, which will kind of get the structure right. And then we'll do another exam again and see how we've improved, where we haven't improved. And then we'll take that information and then we'll come up with more of like an exercise program to kind of strengthen things.
Yeah, do that functional assessment, where it's a computerized camera system where we get to see how well you're moving. It's a scored test, and we use that because it helps rank kind of the top 6 things where you're having problems at here, and then we can literally get you a functional rehabilitation program here to correct those areas that need to be worked on. So it's, we have everything here kind of covered, computerized testing for even our neuropathy patients, computerized x-rays and all that sort of stuff, so we can make sure that if there's structural things going on, we can make sure that we're addressing that stuff as well. So we have, I think we've covered almost everything here now, right? I mean, I think the other thing I can think of here, is more some of the functional medicine things here, where we can literally take your blood work from anywhere. If you bring your blood work in, we can look at it. Except we're going to look at it not as traditional medicine would look at it here. We're going to look at it more from a functional medicine standpoint, or what they're looking at is, are you in the average of where the labs say that you should be at? But they're looking at prescribing medications, or looking at maybe their surgeries they need to do. We're going to look at it in, are you in optimal range, which is a lot tighter range. And if you're not, it's going to indicate probably different dietary changes, nutritional changes. Maybe we need to start talking about exercise programs to do at home even after you're done with some of the chiropractic treatment here. Other lifestyle modifiable things as well, to just help you, again, add years to your life and life to those years. So
Yeah, so whatever issues you might have going on or think you might have going on, we can basically tailor a program just for you, based on what your needs and what your goals are, through our different therapies, through the chiropractic adjustments, through the functional medicine. We can basically tailor a plan that's specific to you. So you're not going to get something that's cookie cutter. We're going to work with you and find out what your needs are and what your goals are individually.
Everybody is different.
Everybody's special.
Even you identical twins out there, you're different.
Oh,
Maybe not genetically, but you are. So, because everybody uses their body differently. But everybody uses their body differently no matter who you are. So you're going to have different needs. You're going to have different goals. So
Yep.
Come chat with us about it, and we'll figure out the best plan to add those years to your life.
Add those lives
to your years.
Add those lives.
Oh boy, they're not really messing it up. Adding years to your life.
I've said it too many times.
It's kind of a tongue twister after you've said it enough.
Said it a few times.
I don't think they've been drinking.
Not yet. All right. Well, thanks for listening, everybody.
Yeah.
Don't hesitate to call us or email us with questions. You can always come in for a free consultation.
Bada bing, bada boom.
Have a good day, and we'll talk to you next week.